6 current ones that are operating or about to open, resume mobile vaccination clinics with support from FEMA and our contract with Jogan Health and local public health and community partners. We're going to add and deploy contracted healthcare staff to vaccination clinics to expand appointments and clinic hours. Lack of staff to put shots in arms is our primary constraint that's led to scarce appointments in some Oregon communities. And we're going to expand our supply of mRNA vaccines. We've asked for and received a supplemental quantity of vaccine from the federal government enough to administer 140,000 booster doses. They've also agreed to our request for increased doses on an ongoing basis because of high demand statewide. These additional doses will help Oregon meet current demand and keep up with the increase we need. Our goal to boost 1 million Oregonians by the end of January is urgent and attainable. We have enough doses. We will bolster staffing for our vaccinators. The only question is demand. We need every eligible Oregonian to come forward for a protective booster dose. Next, Oregon will focus boosters on people who are most vulnerable to becoming hospitalized if they catch the Omicron variant. Our most urgent priority is to protect older adults, especially people in nursing homes and other long-term care facilities with booster shots, as well as people in communities of color that have experienced the greatest inequities in vaccination rates. As of December 16th, 51% of people aged 65 or older have received a booster or a third dose. In the coming weeks, we'll urgently move to protect the most vulnerable Oregonians by deploying mobile vaccination teams to skilled nursing facilities and other long-term care facilities in the next 2 weeks. We'll be working with long-term care facilities to implement their vaccination plans and provide staffing solutions. And we'll be providing incentives to get more residents and staff vaccinated. For under-vaccinated communities, we'll augment staffing at federally qualified health centers and other clinics to help them vaccinate approximately 800 to 1,000 people per day. And we'll work with community-based organizations and trusted community leaders to stand up 35 vaccination events for communities of color around the state, with an additional 93 events scheduled in coming weeks. We know too many people of color were left behind in the initial vaccine rollout. These efforts will also support our continuing urgent priority to protect unvaccinated people of color with their initial doses. Our third priority is to rapidly deliver new COVID-19 treatments and expand needed testing. New and coming monoclonal therapies and antiviral drugs offer the promise of protection against hospitalization. For some drugs, they are effective within a narrow window of time after infection. OHA is working to develop a high-throughput site for monoclonal antibody therapy in the Portland metro area. This site will be open 7 days a week, 11 hours a day, and have the capacity to treat 350 people a week. Registering Oregon healthcare providers with will also be registering Oregon healthcare providers with federal agencies, so they'll be able to quickly receive newly approved antiviral drugs to treat COVID-19. And we'll connect patients to treatment and testing to maximize the effectiveness of these new drugs. Those steps by themselves aren't enough, though. The fourth priority is to support healthcare workers and hospitals in the face of the coming Omicron surge. We're extending our staffing contract to bring more nurses and other healthcare staff from out of state into Oregon's already hard-pressed hospitals and vaccination clinics. We'll use every lever at our disposal, including the Regional Hospital Collaborative and an Emergency Management Command Center, to coordinate the use of available beds, ventilators, and other needed resources. We'll continue to work with long-term care facilities to provide alternative step-down beds to move patients who can be safely discharged out of hospitals and free desperately needed beds. And before mid-January, we'll provide hospitals an interim crisis care tool they can use to equitably prioritize care if doctors and nurses are forced to make heartbreaking decisions in the face of limited intensive care beds, ventilators, and other resources. Finally, we're going to work to change our messaging a bit and connect more people to boosters, treatments, and testing. I know there are many people today who want a booster and are frustrated that they have to wait a week or more for a nearby appointment. As I said earlier, these local shortages are not due to a lack of vaccines. They're due to a lack of staffing in a healthcare system still reeling from Delta's punch. As we expand high-capacity vaccination sites, deploy more mobile clinics, and reinforce FQHCs with more vaccinators, we want Oregonians who are eligible for a booster to know where they can find one. In coming days, we're shifting our outreach focus to connecting people to boosters. You'll see more outreach messages focused on boosters from billboards to spots on social media. For example, next week we'll begin running ads on social media aimed at informing Spanish-speaking older adults that they're eligible for boosters and letting them know where they can get a shot. But the steps health officials take won't stop Omicron alone. Ultimately, the number of lives we save comes to the choices each one of us make. As Dr. Graven's model shows, our own actions can blunt Omicron's surge and keep thousands of Oregonians from going into the hospital over the coming months. The overwhelming majority of Oregonians have exercised their personal responsibility and demonstrated their concern for their family and neighbors throughout the pandemic. More than 8 in 10 Oregon adults are vaccinated. Research shows that Oregonians wear masks in public more than Americans do in most other states. Taking care of each other has been what Oregon has always been about. It's those values we need to call on again. We can reach our goal to protect 1 million Oregonians by the end of January. Get your booster as soon as you're eligible, no matter your age. Wear a mask when you're indoors in public. And keep your indoor gatherings small. To find out where you can get a booster, go to getvaccinated.oregon.gov. Now I'll turn it back to you, Dr. Brown.
Thank you, Director Allen. We are incredibly grateful for the dedication and determination of your team at OHA in keeping Oregonians safe and healthy. With that, Charles, we are ready for questions.
Thank you, Governor. For the reporters on the line, just a quick reminder, we'll be using the raise your hand function to ask a question. We'll start first with Gary Warner from EO Media. Go ahead, Gary.
Yeah, hi, everybody. Wanted to ask, since this began about 2 years ago here, we've had a number of variants come through, especially Delta and Omicron. We've had variants of interest, which are the lowest level, variants of concern like Omicron and Delta. There's this third category of variants of high consequence that we haven't had. And I was wondering if Dr. Graven or somebody else could tell us about that and how likely that sort of variant might come to the state.
Thank you, Gary, for your question, and I'm going to turn it over to Dr. Graven and the folks at OHSU.
Thanks for following.
The answer to your question is, indeed, those are going to have bigger impacts. I think that is forward-looking thought, and I think that there's probably going to be good pressure to indicate a variant like that in that space, because we know that this one is going to create the kind of consequences.
Gymnastics
Sorry,
is
you're running an ad
the
over the replay.
It'll
Stop in a minute.
I think with all businesses during COVID, we've had to find new angles, new ways of running our businesses, a new business plan, new business model, and that's what's made it.
Kind of consequences that that sort of designation is designed for. But beyond that, I'm not tracking that as closely, and so I'll pause with that and see if there's anybody else who has an answer.
Dr. Seidlinger, do you want to tackle that one?
Thank you, Governor Brown, and thank you, Dr. Graven. The CDC and the World Health Organization categorize new variants into how they're going to impact communities. So certainly right now, the variant of concern that's in front of us is Delta, and the variant of concern that is arriving is Omicron. If this has even greater impacts than are forecasted and starts to have the impacts on healthcare systems in countries and other states, the CDC, the World Health Organization, will reevaluate their categorization of this variant. Again, what we know now is that it spreads extremely quickly. It may cause less severe disease, and our vaccines remain effective at preventing severe disease and infection, even though their efficacy or how well they work has gone down. So the steps remain in people's hands to mitigate and blunt this impact. Get vaccinated if you're not already vaccinated. Get boosted if the time is right, and wear a mask when you're in public places, and that will help us all avoid the calamity that we would see if this should spread even quicker and have even more of an impact.
If I could follow on just real quick, what are the factors that would bring a variant of high consequence to Oregon? Would it be that there's still a large number of people who are unvaccinated and are kind of like personal petri dishes for new variants? How can we tap down the possibility of this kind of higher consequence variant?
So the risk for the development of higher consequence variants is transmission. The SARS-CoV-2, the virus that causes COVID-19, mutates, as do many other viruses. And as that virus mutates, has changes in its structure, it can impact the way it behaves. It can make it more transmissible, cause more severe disease, or elude vaccinations and treatments. So the more this virus transmits, whether that's here in Oregon, in other states across the United States, or in other countries, more chance we'll get a mutation that becomes that much more difficult to combat with our existing tools. We're seeing a lot of those frightening characteristics in Omicron. Omicron has just arrived here, but what we see with the spread in other countries and in other states is that it is very quick. And even with less severe disease, it can have severe impacts on our healthcare system because more people are getting sick. We have vaccinations that offer protection, even though they're diminished. But we can increase that protection by getting people boosted, particularly those who are most vulnerable. So anything we can do to stop transmission will stop the formation of these variants. But it is a true team effort. It's not just you as an individual. It's your neighbors in Oregon, strangers across the state that are going to help prevent the spread here in Oregon. It's our neighboring states and other states where people make the choice to get vaccinated and prevent the spread that are going to prevent these variants from emerging in other states. And it's getting vaccines and other protective measures across the world that are going to prevent this transmission. That's what we all need to do.
Thank you, Gary, for the question. We'll go next to Amelia Templeton with OPB. Go ahead, Amelia.
Yeah, hi. My question is for Peter Graven. Peter, like a lot of people, I've followed your forecast closely. I know you have a pretty good track record of predicting things here in Oregon, but there's a lot of new uncertainty to account for. And I'm just wondering, given how astonishing these projections are, have you done any sort of peer review? Have you checked this against, is anyone else doing a state level forecast that you can hold this up against and compare it to?
Dr. Graven, go ahead.
Yeah, thanks for the question. The reality is the uncertainty on this forecast is higher than usual. So if folks who have been following my Delta forecast, those have been very tightly close to what we've seen in actual. This one is, there is more speculation here, right? So we are trying to anticipate parameters that are not fully known yet and then extrapolate out for Oregon. I would say the peak size is the one that I'm most uncertain of. The speed at which it gets here, I'm less. I have more confidence in that. So we're sharing information here. Indeed, that peak could come down. I would like to see it to get below the Delta level. But right now, when we look at parameters that we are seeing, and these are the same kind of parameters that are being advised for CDC modeling and other places to try to predict it. Now, I will say there are not other forecasters who are doing much of predicting Omicron in Oregon. In fact, around the country, you will not find hardly any forecasts yet. So this is early, and they probably will change. And so to that point, the key here is that timing is, in any case, we have this period of time beforehand, and this is why the action is so important. I wanted to get these out as soon as I could. As soon as I knew that we really were dealing with this, and yes, I'm in the same boat as everybody else, hoping that we see a lower peak than this. But right now, this is the numbers we have, and we know we need to take action.
Thank you, Amelia. Our next question is a written question, Governor, from Rachel Monahan at Willamette Week. Rachel asks, Governor, are you committing to keeping schools open?
Absolutely. We know that our children learn best when they are in the classrooms with their educators, their teachers, and their peers. And so I am absolutely committed to keeping our schools open to the extent that we can do that safely. Now that 5-year-olds and older kiddos can get boosted,
They can't.
this is an
She corrected
incredibly
that later.
valuable tool. And obviously,
All right, I'm going to end this broadcast because I already heard the rest of the press conference. It's on Facebook under the different Portland news stations. Thanks for listening with me. To the viewers or listeners and the